So welcome and great to see you all again. This is the last Neuroslimming webinar of the year. Why? Because it's Christmas, it's festive season, it's the new year, the borders are slowly opening, and I have been, people have said, can we have a break? They don't want to miss any, and I think it's a perfectly reasonable thing. So we will resume in February, and the date will be the 2nd of February. But in the meantime, I encourage you to revisit all the webinars we've done. There is actually a lot of, when I sort of went through and just sorted them out, I thought, wow, we've actually covered a lot of ground. So put everything that we've talked about into practice and be roaring and ready to go for the new year. And tonight, I have a huge smorgasbord of poll questions for you, so your brain will get a really good workout. Over to you, Craig, my Chief Education Officer, to just talk you through the technicalities and how to respond.
Thanks, Helena, and good evening, everyone. Welcome. Great to have you once again. Webinar number 8 for the year, so that's exciting. So everybody's got themselves on mute. You've all been trained so well over these 8 webinars, so thank you for doing that. We'll get you to unmute a bit later on to say goodbye and wish Helena a Merry Christmas, I guess. Gosh, that's scary. That's coming up way too close. So down the bottom of your screen, you'll see to the right-hand side, the reactions button. That's the critical one where you can do a clap, thumbs up, a heart, laugh, looks like a celebration popper. So at times we'll ask you to give us a reaction about the content. If you could do that, that would be wonderful. We'll also actually there'll be quite a lot tonight. We're going to do a lot of questions tonight, some polling. We'll give you kind of 20 seconds to fill out those as best as you can, and we'll share those results, and that will form part of that tonight as well. So muting, reactions, polling, that's all part of what we're going to cover off tonight. So without further ado, Helena, over to you.
Thank you. And once again, thank you for your questions and feedback, which form the basis of what we're going to do tonight. So what we're going to cover is bicarb of soda, and does it help in heartburn? That was a question that we left off with last time. Why am I going to focus on B12? What is so special about this vitamin? Does it have anything to do with heartburn or bicarb of soda? Vegetable gums we didn't get to last time, great topic, and cognac, which was another question I received just recently. And I got a few questions about obesity. Does obesity cause cancer? And is there a way of preventing cancer? Can we reduce our risk, or is it really just luck of the draw? And spoiler alert, it's a good news story. So let's just start with asking you one of the questions I received. Firstly, bicarb of soda, sodium bicarbonate, baking soda, is there any difference? Craig, could you put up the first poll question? Because it is important. So what's the difference between bicarb of soda, sodium bicarbonate, and baking soda? Are they all the same, just 3 names for the same thing? Are they similar but different levels of acidity, or I don't know? Very interesting. Okay, well, the answer is they are 3 names for the same thing, and they are in fact all alkaline, which is why they're recommended to neutralize stomach acid causing heartburn. Why the difference? In America, they tend to say baking soda. In Australia and New Zealand, we tend to say bicarb of soda or sodium bicarbonate. That's all. However, I understand why some of you said there was a difference, and that's because don't mistake it for baking powder. And baking powder is different. It's bicarb of soda plus a dry acidic ingredient added. Now, all of these things are used to, so that your dough can rise. And if you, for instance, have bicarb of soda at home, but you don't have baking powder and the recipe requires baking powder, you can create baking powder by adding back some of that acid. How would you do it? Now, remember that bicarb of soda is much more alkaline than baking powder. So if the recipe says 1 teaspoon baking powder and you've only got bicarb of soda, you would use half a teaspoon of bicarb of soda and 1 teaspoon, double the amount, of an acid. That's how you do it. And the acid would be lemon juice or apple cider vinegar. They're the two. Even they usually use cream of tartar in the product. Okay. So the next question I got, and these are important leading into how they help or not help heartburn. Can bicarb of soda and baking powder, can they expire? Next question, Craig. And how are we doing? Okay, well, very good. The answer is yes, they can actually expire. The good news is it's very easy to test them. So if you're not sure, get your bicarb of soda, add it to a bit of lemon juice or a bit of vinegar, and if it bubbles up, it's still good to go. With the baking powder, you just add it to water, and if it foams up, it's good to go. So there you go. Interesting point. So that brings us to the question, can bicarb of soda or sodium bicarbonate or baking soda relieve heartburn? Third poll question. Yes, the correct answer is yes. Very well done. And here's the important point. Only baking soda or bicarb of soda will relieve heartburn. Definitely don't use baking powder because remember it has added acid. The last thing you want is added acid. That's why I've made a big point of this. However, don't use it on a regular basis. Every so often is fine. Why would I be saying that? Are there side effects? Once again, let's ask the question, are there side effects of using bicarb of soda for heartburn? Very good again, the majority have it. Yes, there are side effects. What are side effects? Well, if you remember last month, somebody asked about PPIs, proton pump inhibitors, which are used as antacids. An example is Nexium. There are several different types of antacids, but let's start with the proton pump inhibitors. Last month, I told you that there was a study found that there was an increased risk of depression. Why? Because of the effect of these antacids on our gut bacteria. More research has emerged that the PPIs, proton pump inhibitors like Nexium, although that's not one of the worst ones, but in general, they all can not only increase your risk of depression, they've also been found to increase risk of gut infections, weakening of your bones, increase the risk of bone fractures, and even increase the risk of type 2 diabetes. Why would this be happening? And it all seems to be an effect on our gut bacteria. So the researchers asked a really important question. Is it just the proton pump inhibitors? Or is anything that reduces stomach acid going to cause these problems? So they tested the second type of drug, H2 receptor antagonists, H2 antagonists or H2 blockers. And what they found was the same thing. It also increased the risk of type 2 diabetes, albeit to a slightly lesser albeit to a slightly lesser degree. And I just realized I've spoiled the next poll question. I was going to ask you, could they possibly increase the risk of type 2 diabetes? I've given you the answer, yes, they can. So we might just have to do away with that poll question. But the moral of the story is this, that what they found was we need our stomach to be acid to support the growth of healthy bacteria, which keep us healthy on so many levels. The diabetes, the depression, the strength of our bones, and protect us from getting infected by other pathogens. So if you need an antacid, by all means take it as infrequently as possible and at the lowest dose as possible. And in a moment, I'll give you other ways to prevent heartburn and other more natural ways that you can relieve it without interfering with your acid. All right, so a related question. Should you be taking vitamin B12 supplements if you regularly need antacids? Next poll question. Okay, well, the answer is yes. And the reason is the following. B12 requires two things for us to absorb it. It requires an acid environment in our stomach, and it requires an enzyme called intrinsic factor. So if you're taking an antacid and you're reducing the acidity of your stomach, you will absorb less B12 from the food you eat. And as we age, particularly over the age of 50, we start to produce less intrinsic factor. Why? I don't know. we start to produce less of a lot of things like hormones as we age. An intrinsic factor is one of these things we produce less of. So me personally, yes, I take a B12 supplement just once a week because we store it in their liver for a long time. So I do recommend my patients take a B12 supplement once a week. And the key is take it under your tongue so it's absorbed directly into your bloodstream, not through your stomach, because remember, you're producing less of the factors that you need to absorb it. Even though if you buy a tablet that you swallow with B12, they'll say synthetic B12 doesn't require you'll still absorb it. I'm not going to why not just take the direct route and have it dissolve under my tongue? Alrighty. Why do I care about vitamin B12? Next poll question. Can vitamin B12 cause anemia or nerve damage or dementia or all of the above? If like deficiency, major deficiency. It doesn't happen with minor deficiency. Nothing will happen with minor deficiency, but yeah. Correct. Well, the majority have it. It actually can cause all of the above. Now, admittedly, in order to get dementia, you have to be very, very deficient. But, you know, with prolonged nerve damage, yes, it's a possibility. So thank you very much. Excellent work. So the next obvious question is, okay, if it's so important, where do I get my B12? Let's ask one more poll question on this topic. I'm going to propose that vitamin B12 is found naturally only in animal foods. Yet true, false, or I don't know. Okay, the answer is true. It is only found naturally in animal foods. And the key here is naturally, because you will get things like breakfast cereals and soy products which have been supplemented with B12, but they don't naturally occur in, can we close the poll so I can change my slide, please? But they don't naturally occur in plant foods. So which foods do provide B12? So yeah, I'll answer that. I'm getting ahead of myself. I'll let you answer this poll first. Which foods do provide B12? I've given you a whole lot. There's more than what you can see, I think. I've got fish, caviar, crab, liver, meat, poultry, eggs, milk. Are there any more options? Or is that it? And you can tick more than one, by the way. Okay, fantastic. The answer is all of the above. All of those are good sources of B12. So, as you can see, if you're an omnivore, fantastic. If you're a vegetarian, as long as you eat dairy products, so eggs, cheese, milk, yogurt, you're fine. But if you're vegan, you will need to take a B12 supplement because you're just not getting any in your diet whatsoever.
Just while you're there, Helena, so a question on, is the amount of B12 in a multivitamin that you take every day enough?
Yes, it would be. You don't need much. 2.4 micrograms is, I think, is the official guidelines. If I'm not right about that, then I will look it up. But I'm pretty sure, I know it's a very small, it's a microgram amount. And yes, it would be enough.
Okay. And then the other question, just back on your antacid, was quickies, you know, the little tablets, yes. Quickies. What you were saying, does that apply to quickies?
It does apply to quickies, yes. Because they've usually got some kind of alkaline bicarb of soda. They're a neutralizing agent. So it applies to quickies. I wouldn't get addicted to quickies either.
Beautiful. Thank you. Let's move on.
Okay. All right. So I predicted that somebody might say, well, how do I know if I'm B12 deficient? Next time you visit your doctor and you need a blood test, if you're uncertain, if you're concerned, just say, could you please add B12? And if you're over 50, they'll find that a perfectly rational thing to be, or vegan. That's a perfectly valid test to have. The one thing is, if you happen to be taking folate for whatever reason, you must tell your doctor, because you'll have to stop the folate before you get a vitamin B12 test, because the two interact. And if you're taking folate, it will mask B12 deficiency if you have it. Why is nothing ever simple in medicine? But anyway, there you go. So now that we've covered all the negatives, so how can you relieve heartburn naturally? Look, sometimes if you catch it early enough, just 4 sips of water at room temperature, can actually relieve it. So try that. Have just some room temperature water, have a few sips of water. Sometimes that actually works. The other more natural things are only these 3 teas: chamomile, liquorice, and slippery elm. Try those and see if they might have a bit of a soothing effect without any of the negative side effects. Most importantly, though, is what to avoid. So these are really well-known things to avoid. You know, your peppermint. By juices, I mean fruit juice because they're acidic. Fruit teas also, definitely none of those lemon teas or no fruit teas because they are acidic and they can aggravate things. Black tea, soft drinks, mustard, onion. For some people, for some very unlucky people, chocolate aggravates it. And I know somebody's going to ask me about coffee. The jury's still out about coffee. For some people, it aggravates. For some people, it doesn't. So it's about knowing your triggers and avoiding them. So the sort of big picture, how are you going to, the best ways to prevent heartburn? Number one, don't smoke, which I don't think any of you do, but, just give yourself a big pat on the back because smoking actually interferes with the esophageal sphincter and stretches it out. And so you're more likely to get a hiatus hernia. Alcohol will also aggravate heartburn in a lot of people. And a couple of points, just don't eat. It's a good advice anyway, for 3 hours before going to bed. Sleep with the head of the bed up to 30 centimetres if you can tolerate, because that prevents the acid from coming back up. Avoid your personal triggers, as I said, and that actually includes stress and sleep deprivation. I could do an entire webinar on the health hazards of sleep deprivation, which I might once, but just don't underestimate stress and sleep deprivation in terms of aggravating everything, including heartburn. Eat slowly and mindfully, and avoid aspirin and certain anti-inflammatories and anticholinergics, which can be found in cough medicines or medicines to help people with leaking bladders. So just ask your doctor anytime you're prescribed something, could this aggravate my heartburn? Because everything interacts with, a lot of medications interact. So there you go. That sort of, I think, covers, heartburn and bicarb of soda and that topic. So now vegetable gums. Let's move on to a new topic, which I was also asked about. So are they harmful? Yes, everyone should avoid them. No, they're actually one of the few completely safe and natural additives. It depends. The poison is in the dose, my favorite phrase. Or I don't know. Pretty good. I believe that I don't think it's possible, and you'll see why in a minute, to avoid vegetable gums. They are in literally everything. So the answer is the poison is in the dose. Otherwise, we'd all be carking it very, very soon. Okay. So the first question is, what are they? What then are vegetable gums and why are we using them so much? Okay, what they are, they're also called natural gums. It's a type of carbohydrate and they are found in the woody parts of plants or in the coating around seeds. And when a plant is injured by trauma or it's attacked by a bacteria or a fungi, gum flows to the site of the injury, a bit like, blood and flows to the site of an injury in a human. And the gum forms a protective seal and then it's dried by the air. And it's very much like a scab over a wound in a human. So that's what vegetable gums are. Where do we get them? Obviously, I've just told you one of the plants, seaweed, and we can also produce them by bacterial fermentation. So yeah, they are actually natural and not much. I mean, there's a little bit of processing, but not too much. If you would like to know them, and I will talk about some of them, they're designated usually an E4 something number, between E400 and E420 usually. E just stands for European. So, and we tend to use those numbers. And these are just examples of some of them. Carrageenan is one from seaweed. That's actually the most controversial and the one I would avoid the most. Guar gum is used a lot. That's one of the plant ones. So is locust bean, so is tara gum. They're all from plants. And then you've got the gellan gum and xanthan, which are produced by bacterial fermentation. So they are your gums. Now, what do we use them for? they are, now you think about them, they're gums. So they're used to thicken foods. They're used to help foods hold their shape. They're used as emulsifiers to stop mixtures of oil and water from separating. They're also used to help things stick together. They're also often used as gluten substitutes to sort of add a bit of bulk and texture. So they're just some of the uses. So you can already see that they're going to be used in a lot of things. So my next question to you is, poll question, I'm going to give you a list of foods, a whole lot of list of foods. Which ones do you think might have vegetable gums in them? What was our answers? Well, the answer is all of those things not every brand, not every jam, not every breakfast cereal, not every soup, not every sauce, not every salad dressing, not every ice cream. However, all of those products are known to contain vegetable gums, the more processed they are. Can you see how we are eating these really weird things that I don't know that we were meant to eat? Now, it doesn't mean it'll kill us, but this is why I've got that. My biggest message is just stop eating processed food, because if you eat any processed food, you're eating vegetable gums, whether you like it or not. Just out of curiosity, what products do you think have vegetable gums in them? Another poll question.
100% all of the above.
Very good, 100% correct. Okay. All right, so I think I've made the point. Vegetable gums are used in all processed food, soup, sauces, ice creams, toothpaste, cosmetic, medicines, not all, some medicines. Again, it's just to help them stick together or bind together. Yeah, amazing stuff. Okay, I don't know why that went backwards because I meant it to go forwards. So not final, but another poll question. So, you know, I'm going on about possible negatives, but do they have any possible health benefits or claimed health benefits? All of the above have been claimed as benefits. And because they are fibrous, they certainly are a source of soluble fibre, and they can keep you feeling fuller, but I'll elaborate on these. They are theoretical health benefits. However, there are a zillion better ways to get soluble fibre, to get prebiotics, to improve your blood sugar, and to help your bowels work better. All right. So yeah, theoretically they have those health benefits, but I would find other ways of providing myself with those health benefits. So yes, just summarising that has all been claimed. The weight loss, by the way, it has not, the studies haven't borne it out, but you will find gums in weight loss products. And that's because they swell up. So they kind of fill you up and you think you're less hungry, but it doesn't actually stop you eating more. So final poll about vegetable gums. Can they have harmful effects? All of the above, once again. Correct. So can you, and that's because, and I'm going to tell you a few horror stories in a minute. So definitely, you know, it's always the poison is in the dose. Some people, even a little bit, they'll have an allergic reaction. Some people, it really interferes with their absorption of things like zinc and calcium. Some people with irritable bowel syndrome or Crohn's disease or ulcerative colitis, if you've got bowel problems, I don't think these are going to be doing you any favors. So have as little of them as possible. So I just wanted to share two horror stories, or three horror stories actually, about vegetable gums. Firstly, there was a weight loss product with Carrageenan in it, and it caused a whole lot of gastrointestinal products, and it has been absolutely banned. So my message here, Carrageenan is the most controversial, the most likely to cause allergies, the most likely to cause interference with blood sugar regulation. And from memory, E407. So avoid that one the most if you can. But basically, if you see a weight loss pill or product with Carrageenan in it, avoid it, because it's bad news. Xanthan was used as a thickening agent. And again, it's the poison is in the dose. If elderly people have swallowing problems, sometimes they add They have products for them. They add xanthan to help them swallow things, but they actually caused an almost fatal condition in newborns when they put them in infant formula, because they caused death, called necrotizing enterocolitis, and it caused a lot of damage to their bowels. So you really don't want to be overdosing on this stuff. And there was another one with Guar gum diet pills called Calban 3000, another diet pill where they actually, a person's stomach just went, almost exploded, because the gum absorbed so much water that it just kept expanding and expanding. So, as I said, avoid them if you can, and certainly in high quantities. And basically all emulsifiers, these are two others that have been studied, and are often found in ice cream. So avoid these two in particular, because they have a measured effect on a bacterial protein called flagellin, which causes inflammation. So I've been asked a lot of questions about, you know, how to avoid inflammation. Avoiding emulsifiers in general is one of them. Particularly, and these are not gums, by the way. These are just, gums can be used as emulsifiers, but not all emulsifiers are gums. But these two particular numbers have been studied and are not good. Okay, then I've got a question about cognac. What is cognac? Also referred to as cognacu. Basically, it's made from the root of a plant. By the way, it goes by all these different names. Amorphophallus. I'll leave your imagination to decide why it's called that. But basically, it comes from the root of a plant, usually grown in Asia. And it has this root has a very high amount of fibre called glucomannan, and they turn this fibre into a flour. So what you'll find it in, it's found in noodles, in rice substitutes. It's also used as an alternative to gelatin. Sometimes it's used similarly to gums, and it's got a lot of the same qualities. It can be used as a fibre supplement, weight loss supplement, lollies, and it often replaces gluten in gluten-free products because it can give that texture. So that's all the places that it's been used. The only way I would consume cognac, and I'm not saying it's a bad thing, it's not, because it's just like a flour, but it's got 0 calories, 0 carbs. It's kind of like eating nothing, really. It doesn't give you any vitamins, any minerals, negligible calories. So if you really like a lot of noodles, then these are kind of like a cheap way of eating carbohydrates without the carbohydrates. Do not eat cognac in any other way, not as a fiber supplement, not as a weight loss supplement, not as lollies, and gluten-free. Well, then that's just another use, which is fine. And that's because there are more horror stories with cognac as well. It does not, if you take them in lollies, it doesn't dissolve in the mouth like normal lollies, and children, you know, babies, young children, elderly have actually choked on them. In the same way that I told you stomach can expand with xanthan gum, it can also expand with cognac. It can cause bowel obstruction. It's been banned in some countries because people who want to lose weight but love their carbs will just binge on these cognac noodles, which is not what they were designed for. And therefore they swell up in their stomach, and they run into trouble. And some people, of course, can have allergic reactions. So the bottom line is, I'm fine with you having, say, cognac noodles once a week or cognac rice once a week, not a problem. I wouldn't make it a staple, but I certainly wouldn't worry about it more than one, you know, just once a week. And it's really just like corn, by the way, is the name of the root. But just remember, it has twice the fibre of regular pasta. So if you've got a sensitive gut that tends to err on the side of diarrhea, just be careful, you may get diarrhea. On the other hand, if you're somebody who more likely to get constipation, you might love this once a week because it might help you with regular bowels. So, you know, my eternal message, the poison is in the dose. Okay, and I just wanted to say, I had to finish with one last cognac horror story. This happened in Melbourne, 61-year-old woman. It was March 2018. Her stomach swelled, is that a word? 5 to 7 times its normal size for 10 days because she got an obstruction, because she just had these noodles straight, like a whole packet with nothing else. That's not what they were designed for, okay? All right, so the message here is Goldilocks was a guru. You know, if you're ever in doubt about something, Goldilocks knew. Not too much, not too little, somewhere in the middle. Not too hard, not too soft, somewhere in the middle. There we go. And these are the products that you know, one of you photographed and sent to me to comment on. So yeah, so as you can see, tiny number of calories, but just don't overdose. Okay. Now, we'll close with a good news story, but firstly a poll. Can obesity increase the risk of getting cancer? 100% correct. Very good. It can increase the risk of cancer. Why? Because of the metabolic effects. It just interferes with our hormone production. Just one example, it increases estrogen, and the more estrogen you get, the more likely you are to have breast cancer. It increases in a negative way. So that's one example. So yeah, it's a sad story, but it does. Just another related question. Can alcohol increase the risk of cancer? Correct, particularly breast cancer and liver cancer. They're the two really big ones with alcohol. I forgot to mention there's one other reason why obesity increases the risk of cancer. Is because they found that if you are obese, all your organs are a lot bigger as well. So there's more cells. And when there's more cells being produced, there's more chance that some of those cells will malfunction and start to multiply out of control, which is what cancer is. Okay, but the cancer story is a good one because, yes, there is a genetic component to everything. There are some people who inherit genes which make them more likely to develop cancer. But there is no one, really got to think hard. There are very few people who will have a cancer that they just can't change the course. Even if you have a gene that increases your risk, doesn't mean you will get the cancer if you manage to avoid environmental factors that might trigger it. So the big ways to prevent cancer, and I'm giving you the top 12, this is half of them. So you can give yourself a real tick, see how many you can tick off. Don't smoke or drink alcohol, obviously. And it doesn't mean, again, with smoking, there is no safe level. Even one cigarette a day significantly increases the risk of heart disease and stroke. So, and even the odd, you know, weekend social smoker, you increase your risk of lung problems. So there is no safe level of smoking. As far as drinking alcohol, the new guidelines actually say no more than one a day for both men and women, with 1 day off a week. So really no more standard drink, which is 100 grams of alcohol. So really 500 milliliters. I think that's half a bottle if the bottles come in 1 litre. But anyway, 500 milliliters a week is a safe level. Avoid sugar and vegetable oils as much as possible. That's another one of my catch cries, which just means avoid processed food. But again, the poison is in the dose. A really, really interesting finding. Don't suppress your emotions. There have been studies finding that if you are a very giving person, and you allow people to take advantage of you, and you don't want to rock the boat, and you don't want to speak up when something upsets you, but it really is upsetting you, that is a risk for cancer, especially breast cancer. So speak up. Like I had to learn the difference between being assertive and being aggressive. And I used to hold back my emotions because I was afraid that I would be considered unladylike. And I lived in a house where anger was just, there was no place for anger, especially for a child. So I had to keep up a brave front and just, yeah, not be angry. It's not healthy. I'm not saying go and smack somebody across the head, but I'm just saying express how you feel in a socially acceptable way. Ring somebody up, have a cry, but don't hold it in. And the two most detrimental emotions are suppressed, hostility. So when you really, and sort of suppressed hate and hostility. So forgiveness is a really sort of good healing thing. Sleep deprivation, less than 7 consistently throughout life. Again, when you have a child, newborn child, you're not going to get much sleep for at least a year. That's not going to give you cancer. But a lifetime of not sleeping enough is going to give you potentially cancer, if not something else. This is just a trivial question. Not a trivial question, but I've just got to bring this up because it's just come to me. I want you to think about, what do Margaret Thatcher and Ronald Reagan have in common, apart from the fact that they were both heads of state and both married? Two things that they had in common, which are relevant here. I mean, I haven't asked a poll question, but I just want you to think about it. Ronald Reagan, Margaret Thatcher. Here are the two things. They had very high stress jobs. And number 2, they both bragged about how little sleep they needed, and sleep was for sissies. That's my wording. But Margaret Thatcher, I think she said she never got more than 5 hours sleep a night. Ronald Reagan also boasted about getting little sleep. What happened? They both ended up with Alzheimer's disease. Is this a coincidence? I don't think so, because the studies have found that if you are sleep deprived, you are not clearing a protein from your brain called amyloid, which is associated with getting Alzheimer's disease. So sleep, super duper important. Prioritize it. If that's not working for you, make that your priority between now and February. And I can recommend a good book, How to Get a Good Night's Sleep by Carmel Harrington, Australian, Melbourne researcher, brilliant. Okay, and the other ways to, when I say prevent cancer, all these things reduce your risk, obviously. You can still, one can still be unlucky or be exposed to environmental toxins or asbestos or, whatever. Regular exercise, 30 minutes a day. Now, the latest research is saying the 2 most important things about exercise are anything is better than nothing, and 2, enjoy it. Because if you're not enjoying exercise, you produce cortisol, which actually mitigates all the positive brain and body effects of exercise. So, and you don't have to kill yourself. You just have to get out and do a brisk walk, or go dancing, or do a gym class. Mix it up and enjoy it. Stand up every 30 minutes. That's a really important one because of the biochemistry, how it just upsets your whole biochemistry for sitting for too long. So just stand up for 2 minutes every 30 minutes, hence why I do these webinars standing up. Manage stress, I've talked about. Meditate. Meditation works on various levels. One of them is it reduces your stress. But 2, the more we study meditation, the more we're finding positive brain and body biochemical effects, to the point where meditation even improves people with psoriasis, skin conditions, allergies. It's just because it has such a profoundly healing effect on our immune system. And our immune system going wrong is the cause of allergies, asthma, cancers, Alzheimer's. So learning to meditate would be another great thing. And again, it doesn't have to be for 2 hours a day. Even just a couple of minutes every morning and evening makes a difference. And there are a lot of free apps that you can use. Eating cruciferous vegetables, what are they? Broccoli, cauliflower, and eat them with a sprinkling of dry mustard powder. You can use mustard, but you just need a high dose. But don't heat the mustard powder. Sprinkle it on after you've cooked them because it helps to bring out the anti-cancer properties. So your cruciferous vegetables are, the classical, as I said, broccoli, cauliflower, Brussels sprouts, bok choy, those kind of vegetables. Eat all vegetables. I mentioned cruciferous because they're the ones that have actually been studied with regard to anti-cancer properties, but all vegetables have positive effects and help keep us healthy. Avoid processed meat. Now, I'm not against meat at all. However, processed meat like bacon, prosciutto, all those sausages, pressed things, all those processed meats, if eaten more than once, not quite once, twice a week, do increase your risk of cancer, well, particularly bowel cancer. So don't go too heavy on the bacon, even if you're, nothing wrong with paleo, but, well, there could be a few things wrong with paleo, but that's another story. But, you know, on the whole, paleo diets are quite healthy, but don't go overboard on the bacon, please. And maintaining good relationships. If you, again, because it helps your immune system, it lowers stress, it works on so many levels, and research has found if you do get cancer, if you have a good social support network, whatever that means for you, whether it's one person, whether it's a group of people, whether you attend support groups, whatever you need for support and feel, you know, is nurturing you, that actually helps you recover better. So you do better if you've got good relationships, even if you get cancer. Okay, final poll. Thank you very much. That's made my night. I'm really glad that everyone learnt something. Okay, are there any questions before we go? By the way, I'm going to recommend, only for the people who are in Queensland or Perth. If you're in Sydney and Melbourne, you've missed it, I'm afraid. But one of you lovely people suggested that we watch Insight tonight at 8:30. Hungry, why are more people experiencing food insecurity? I think it's a really good question, and it sounds like a really good episode. I do watch a lot of Insight. I think Jenny is excellent. But yeah,
you probably get it on Catch Up TV as well.
Yeah, of course, of course. So are there any questions? Any more questions?
There's none in the chat at the moment. Everything is fine.
Loved my sessions with you. I really appreciate everyone joining in and being so interactive and always providing questions. So yes, have a wonderful festive season. Wow, isn't it going to be a big celebration at the end of this year? It's been wonderful, and I look forward to seeing you in February next year. All the best.
Thanks, Helena.